Levi here, welcome to the channel. This part of the professional series is talking about no pain, no gain. That mindset, if you're a personal trainer or anyone in the realm of health and wellness who is a professional and offering a service, if you pursue your practice from a no pain, no gain perspective, I would like to encourage you, maybe even challenge you, ask yourself if that's getting the results you want. Is it showing the return in the clientele? Is it showing the benefit in the session? Are people's bodies responding well to it? Are they leaving hurt or more damaged than when they came? Are they needing week or more to recover? It depends on your demographic too. Are you dealing with people who just want motivation, want to push? Because if so, that might work for them. But anyone who has any structural threats or issues that they're looking to heal their body through, I want to offer an alternative to the no pain, no gain. And this one is really honoring the realm of safety, but not just so that we can kind of hole up in there and stay safe and not grow, but how to use the idea, the paradigm of safety versus threat to allow safety to be the domineering space in your mind and your psyche and your movement. So as a professional and working with not just my own clientele, but teaching many, many professionals, I have found that defining the spectrum of what most people consider either safety or threat, or it feels good versus pain, and understanding the nuances that live in the middle of that is really empowering. You're gonna have people, whether they're in the middle of a stretch or an exercise, or they come to you and they're like, this hurts, or this is in pain. A lot of times, that's all that they have the vocabulary for. And when I start to introduce, like, here's what I perceive as like, right here, the movement feels safe. Right here, you're not so sure. Right here, you know that there's pain. There's so much that we can accomplish if we specify this not so sure area and this place in people's mind that they might perceive as like a threat, because it's unknown, they don't know how to navigate it. And that's, as a professional, a real huge gift that you can offer, because you get to be the one observing their movements and you can help to facilitate them understanding what feels safe, what feels uncomfortable, and what feels painful. So let's say that I have a client doing a lunge, for instance. So as a lunge, and you might have, from your professional perspective, them on one knee, them arching their back, them doing all sorts of contortions. And what I look for is the psoas, the area that we're looking to stretch. Is it being stretched? Or is it just in that position? It looks like the stretch, but there's compensations, there's wincing, there's tensions that don't need to be in place. And are we actually progressing deeper into the stretch? I like to gauge my sessions off of if we're actually getting the joint to move in a beneficial manner. So let's say I'm in this lunge, and let's say we're not doing no pain, no gain. Let's say we're just listening to the body and where it's at right now. And I have you tuck your hips. Like, I like to explain this to the client as if their hips are a bucket of water, and either water is being tipped out of the front or spilled out of the back. And that tends to give people a visual to really connect to their hips. Otherwise, they have a hard time with it. So remember that bucket visualization, and then have them just isolate here, spill the water out the back, and then once they find that, then they can use their knee to create kind of a lever movement here at the fulcrum of the hip. And this is where we want the stretch. And we don't even have to go into pain. If we go into pain, it's going to create a threat. We just want to go to where it's uncomfortable, but it's not guarding. Guarding being like the brain is already perceiving threat and trying to figure out if it needs to respond with safety measures. So don't go there, because we want the brain to open and feel available to movement. But live right there at the edge of it, right before the guarding kicks in. And that's what I call the sweet spot. And as a practitioner, if you can start recognizing how to navigate these sweet spots in movement and stretch and exercise, you'll find the benefits and the leaps forward that your client takes are really astounding and really rapid, and their brain starts to feel safe. So I'm going to take some breaths here. And already when I'm honoring that region of its uncomfortable uncomfortable, but it's still safe. And it's right before a threat, so right before guarding. That's where my brain says, okay, this feels safe, this feels right, I'm gonna give you more movement. I want to also talk about how this applies to the session in general, your demeanor, the atmosphere, the room. As much as you can be mindful and even be aware of what you already are doing in the session, but some things that you can challenge yourself to grow in. What are some ways that you can help create a space that feels safe? Especially if you're working in the realm of corrective exercise or any sort of therapies that are meant to create a space for healing. In my experience, whether it be through physical movement or my personal emotional life or friends, family interactions, as much as I can create a safety environment for myself and them, they're more prone to open and more prone to heal. I know I am. So apply this to movement, give it a try, like, subscribe, let us know what you think. I'd love to hear your comments on it. I'm also, as an educator, learning all the time from the people I teach. And as a professional, I'm excited to engage with you and interact. So give it a try and let me know what you think.